Hi everyone, welcome to this bonus tutorial. I'd like to start off by thanking you for joining the Mastering Dental Photography webinar. You're going to love this webinar. It's going to be held on September 7th, and what I would like to do today is share with you a quick little video that will show you the 4 tools that I use in Photoshop to edit dental images. So what I'm going to do is I'm going to go over here, I'm going to drag this photo down to Photoshop, basically from my desktop to Photoshop. Here we are, the photos in Photoshop. Now I find this a little distracting having the desktop behind the photo, so I'm just going to go here and put it into full screen mode with menu bar, and now I have a better image to look at. I set my background to gray because it's easier to look at dental photos. So essentially the first tool that I'm going to use is to crop the image. Typically most of my dental images I take are a little further back and then I crop them. I don't try to get too far back, but I find that I have a little more flexibility if I take the image a little further back. So you go over here to the toolbox, you click on the crop tool, which is this one, and then you just come over here and you fill out the area that you want to crop, because I'd like to get the retractors out of the image and I'd like to have the central incisors centered. So there we go, we've cropped it. So all I've done is hit enter to crop the image. And this Photoshop program can be used in a Mac or a PC. I'm using a Mac, but you can use it essentially the same way in a PC. And this image here is actually a full mouth rehabilitation that I worked on this week. This patient came in to see me because of excessive wear and erosion. He found me on my website and said he really enjoyed looking at the photos, before and after photos on my website. So obviously clinical photos can lead to more, having great clinical photos can lead to more treatment and more people finding you and seeking you out for help. So for this patient, I actually prepared the teeth in 2 days, prepared the upper arch one day, prepared the lower arch another day, placed the provisionals. I did take some final impressions on the lower arch. I didn't take final impressions on the upper arch because I wanted to manipulate the gingiva more. And then I took a bite record so that we could create the lower arch while the gingiva is maturing on the upper arch. And I'm actually going to do a little YouTube video explaining the reason behind that and what I was doing here, and post that online probably in the next week or two, and you'll get an idea of what this case involved, at least some basic ideas at the beginning of this case. So what we've done first is we've cropped the image. Now we have a good image, not as many retractors in view, and what I want to do next is I want to check out the levels. So I want to see how the image looks as far as exposure goes and tonal range. So if you go into, let's see, go into image, go into adjustments, and then click on levels. So let's walk through that again. I go to image, adjustment, and levels. I click on levels, it brings up the histogram. Now typically the histogram, you want to see the peak somewhere in the center, and you want to see it looking like this for most clinical photos. This is a pretty good clinical photo, but if I printed it out, I suspect it would be a little dark. So what I want to do is I want to take this far histogram triangle right here, and I just want to pull it over a little bit. And this will spread out the tonal range. There'll be less gray in the background. And if you look over here, the image just pops off the screen a little nicer because I pulled that slider. And we can look at preview, could turn it off and turn it on. You can see the image just looks a little better. It just pops a little nicer. Here's without the adjustment, and here's with the adjustment. And that's something that I do on most of my images, and you could play around with it. You don't want to take it all the way past where the histogram's tail kind of gets small, because you cut off a lot of your image. It looks terrible. So you want to take it somewhere, you know, halfway, 3/4 of the way towards where the tail starts getting small, and it just makes the image look a little better. And it prints better as well. That's another big key, because you want to be able to print these images sometimes to show patients to take home. So I like the way this looks now. I've created this slider, pulled this slider about 3/4 of the way. All I'm going to do is hit OK. And now this image has been edited to a pretty reasonable level. I suspect this would print quite well. The next thing that I want to do, I've done cropping, I've done levels. Now I want to sharpen the image slightly. So I'm going to go in again to Image, Adjustments. Sorry, I'm going to go into Filter, Sharpen, Unsharp Mask. So here's the thing with sharpening. Sharpening makes the retracted images look great for teeth. I don't like sharpening faces very much because it just doesn't look good. People look worse. But for retracted image, the sharpening makes the images just look really great. So I'll typically use a radius of 1. I don't use a very high threshold, usually 0 to 1, maybe 2. You know, keep the threshold low. And then the percentage, you want it below 100 typically. So you can sharpen, you know, anywhere from about, say, 50% up to about 85%. 89% is what I had it there. So let's go up to 89% again. And again, preview. Let's look at this. You know, it's a subtle thing, the sharpening, but it just makes all the image look pretty good. You know, you could over sharpen too. If you went up to, say, 275%, it just looks artificial now. I find that the gingiva doesn't look quite right. But if you go down to, let's say, 89%, where we had it, you look at the gingiva, it just is a little crisper looking with the highlights. So that's sharpening. I'll hit OK again. And I'm pretty satisfied with this image now. The levels look good. I like the cropping. The sharpening has a little added bonus, makes it pop a little better. If you want to sharpen a face, I would take that and leave it maybe 10-15%. I wouldn't do more than that. Sometimes if your image is really soft, my images in my camera, I'm using a D3S for this, are fairly crisp as it is. If an image is really soft, you can go beyond the 100%. Just be careful. Over sharpening makes the image start to look artificial. So what I want to do now is I'm going to save this image and then show you the fourth thing that we use. So I'm going to save it as and a copy, because I'd like to keep my original image as well. So we're going to put it on the desktop, and I save my images as JPEGs maximum. So OK. So we've saved that image. Now the fourth thing that I use is grayscale, because I find that black and white images look good. They kind of are nice to show people. And the other good thing about black and white images are useful is for shade photography. So you can show a color image and a black and white image of your shade tabs, and the shade tab looks, you can tell the value a little bit better with the black and white image. So we'll go into mode again, adjustments, black and white, and just say OK. And there's our black and white image. Now there are other ways to do black and white images, but this is the simplest one. So let's just undo that again. So again, image, adjustments, black and white works. You can also desaturate all the colors. That works. But this works nicely here, just default black and white. And that's it. Now we can save this image. I'll save that again as a copy. You don't want to lose your original color images, so make sure you definitely save that as a copy. Replace, blah, blah, blah. No, let's cancel because we already have a copy of that. So we'll say BW. Save that. And there you go. Now we'll exit Photoshop. Save changes to Adobe Photoshop document before quitting. and I won't save because I want the original. I didn't save the original. So here we are. We have our original, we have our cropped image, which has been cropped, leveled, and sharpened, and then we have our black and white image, which is a copy of the cropped image that has been just desaturated into black and white. So there is our edited image here, and here's our edited black and white image. So again, you'd go grayscale or black and white with your edited image after you've saved your edited image as a copy. So now we have 3 versions of the same image. One cropped in black and white, and one original. Now you don't always have to do the black and white. They're just handy, and you know, they're kind of neat. It's kind of neat to print them out and have them around the office even if you'd like. And so that's a quick tutorial on Adobe Photoshop. I do go into a lot of detail on Adobe Photoshop and Aperture in my Mastering Dental Photography DVD, but this gives you the essentials. You know, that Levels tool is a really cool little tool to just make your images pop and look a little bit better. They can look actually substantially better just by doing that. Actually, let's look at the 2 images now. So this is the edited image, and this is the before image. And if you look at those, you know, the edited image, the color and the exposure and the tonal range just looks so much better just because of levels and cropping, and then a little bit of sharpening. So anyway, that's editing your dental images. And I would suggest you edit your dental images, or you train a staff person to learn how to edit your dental images, because I do see a lot of potentially great dental images that have just not been edited. And it takes me maybe 30 seconds to edit a dental image and take it from being an okay dental image to a great dental image, which you can use on your website, you can use for case presentation, you can use in social media. There are many uses for excellent dental photography. So thank you for joining me on this tutorial, and we'll see you soon. Take care.